Hi, my name is Mia Ahlgren and I work at the Swedish Disability Rights Federation. I have long blonde hair to my shoulders, I wear glasses, and I smile a lot. So today I'm going to tell you a little bit about live subtitling during the corona pandemic, and I have called the presentation Doing It for Ourselves. The Swedish Disability Rights Federation is a national umbrella for 46 member organizations of persons with disabilities. They are represented here with their logotypes in different colors and shapes. We are not so many people working at the umbrella, about 8 persons, so we do a lot of different things. I, for example, work with human rights, national disability policy, and universal design, accessibility, standards, you name it. We are also very active in the European Disability Forum, where we are a member, and I've been working in a network with the European policy since 2003 when I started in the organization. As we all know, there are so many people with disabilities that have been hit hard through by the coronavirus. I have been working from home since March. I haven't been once to the office actually, uh, but we've been doing quite well in the organization. But for individuals, there has been a lot of exclusion from education, from work, from emergency information, healthcare, getting medicine or food, and of course from social interaction. According to a recent study about persons with disabilities and internet access, there is still quite a big gap. Uh, Persons with disabilities are different, so it's not the same if you just share the same disability because it's only one of several layers of identity. So one person might even not even have access to internet when another person with the same impairment is doing very well and employed and working. Many of the services, web-based services, are not so well designed. So it could be very hard also to access, understand, and use these services. But for us as an NGO, on the organizational level, we've been doing quite well actually. So we have been actually doing better, I think, sometimes than the public agencies who have been forced to use software for security reasons that are not working very well to have meetings online. As a small organization with a very tight budget, we know all about making ends meet and trying to be clever about the money. So in this situation, when we all had to do webinars and meetings online, we teamed up with others. In this case, we found the only Swedish training for real-time captioners. It's a 1 year blended learning at the Södertörn Folk High School. And we were quite lucky actually. We had already decided to start trying to work with webinars before the coronavirus hit us. So we had met with the students at the school in a face-to-face meeting where we could tell them about our work and even try to use Zoom for live subtitling. It's quite easy actually to assign somebody as a participant at the meeting or to use a third party captioning service. But it proved to be quite difficult anyway because the old software used for live real-time captioners where the captioners sit face to face next to the person hard of hearing or deaf who is in need of the captions. It proved that these old software were not compatible or interoperable with the new digital platforms. But there were other win-win situations. This training involves 6 weeks of internship at regional centers for captioners, real-time captioners and sign language interpreters. And when the corona pandemic hit us, these centers could not operate as they usually do, uh, with the persons using caption services sitting face to face with each other. So the internships in many regions were cancelled. But through the cooperation with us, with webinars, we could offer internship, and we could also allow the students to test working remotely and trying out new software. In this way, we could provide an example from civil society to the public sector that even without a lot of money, we could provide meetings with live subtitling. So, working with NGOs like our organization as a test bed for innovation is not the first time we've done that. Actually, 10 years ago, we worked with Richard Gatarski, who is one of the keynote speakers here at this conference. He helped us with a solution to provide open sign language interpretation and live subtitling 10 years ago already. So at this image here, it shows us in three persons sitting, interviewing each other with a sign language interpreter on top of the image with a green screen behind her. So in order to make this work, this co-creation and using our organizations as test beds, I think we have to be very careful to make sure that it's a win-win situation, so that it's something that is really needed in our organizations. Uh, that is and also, of course, it has to be beneficial for all stakeholders involved, as it was in this case. To look a little bit ahead to the future, I would like to bring up an issue that has been brought up by Pilar Orero from many, many years, and it's about quality. We can now see an increase in demand and supply of live subtitling services. Even automated captions is coming to be more and more easy to integrate even in other languages than English or Spanish. And of course, that is very good for most of the cases, but sometimes quality is becoming an issue. We heard from a student not so long ago who is studying at the university. Her course that was used to be on campus, where she had a sign language interpreter or a real-time captioner assigned, has now become a MOOC with live subtitling, but the quality is really bad. So the question is, if you are a student and you want to compete for high grades at your course, or if you are working and you have a meeting where you are supposed to make a very important decision, are these services that we have now, are they enough? I don't think so. We have to wait and work together to improve the quality and find out which guidelines we are going to use. At the moment, we have some guidelines that have been developed by the professionals It has not been done together with the users, and so far I don't think they have been used very much in procurement of services. So we need to work together and find solutions that are both inclusive and meeting the needs of a very diverse population. With these words, I would like to thank you and hope you will get in touch with me if you have any questions. My email is mia.ahlgren@funktionsrätt.se or Twitter mia_se. Thank you.